over the past few videos, I know I've been talking about my weight gain, and that's because, well, for VSG, I got to my lowest about 2.5 years ago. And after getting to that low, I did regain 10 pounds. I was okay with that because with my lowest, I was down 20 pounds from where they said I would get. And then, so with the weight gain, I was still down 10 pounds from where they said I was getting. I was okay with that. However, over the past year, with me being sick and these different treatments, I have gained a substantial amount of weight. It started off with steroid treatments and causing like a yo-yo effect. Like I go up 10 pounds, lose them, go up 10 pounds again. And then changed my daily medication. Like changing the daily medication for my trigeminal, I saw my appetite increase an extreme amount. I was hungry all of the time. And my neurologist prescribed it. I saw a general practitioner, and during this appointment, I bring up weight loss and potentially doing some type of medication. She tells me, you don't need to lose weight, you look good. And besides the medication you're on, she had a patient that began it, and a month later, the patient had gained 15 pounds. And that was discouraging to me. And I'm like, you're telling me this, but you're telling me that I don't need the medication for controlling my appetite. But then she says that she would suggest I talk to my neurologist about changing medicines. So I talked to my neurologist. She switched me back to the previous medication for my trigeminal, just at a higher dosage. Thing is, that also causes weight gain. And I've been on this medication for the past few months. In fact, we've increased the dosage a couple of times because what happens is it controls it for a while, but then I have this breakthrough pain. And with that breakthrough pain, it puts me in the most excruciating pain where I have to go to the hospital. And the only way to control it is to increase the medication again. So we keep having to increase it. Now, I mentioned earlier, I'm having some of that breakthrough now. So we're going to have to increase. Well, I'm going to talk to her later today about increasing it. But because I have surgery scheduled for next week, hopefully I won't have to worry about this for too much longer. But with that, I have gained about 25 more pounds. I've gained a total of 25 pounds, and I don't like it, but I've been blaming it on medicine. Yes, the medicine has a lot to do with it. I say life happens. My life happened to be me getting sick. But in addition to me saying it's my medication, it's my sickness, I also want to take the time to acknowledge the fact that with VSG, after so long, a lot of patients do see weight regain. And it's important to stay on top of it. For me, it kind of like I was slapped in the face because of the medicine. Like I was doing so well, and then the medicine gave me an excuse because I'm thinking once I come off of it, it's once I get better and come off of medication, like I'm gonna go back to where I was. But realistically speaking, like I've seen a lot of people that got VSG around the same time that I did or a little before, and they're all experiencing or have experienced weight gain. This happens to be my life happens. It's gonna be different for everyone. The way I am, since I'm still on medication, the way that I'm controlling it, I have met with another doctor, and what I'm doing is I'm gonna begin a once weekly injection called Ozempic. Ozempic is meant for controlling diabetes. However, when with patients taking it, they saw that it showed great progress with weight loss. So what they did was they went and they renamed it, increased the dosage, and renamed it Wegovy. So a lot of people are taking Wegovy now to for weight loss. Wegovy is on, I guess, back order. They're out of stock. My pharmacy says that they don't foresee having any more until the beginning of 2022. That's a long time from now. But I didn't want to wait that long, so I went ahead and decided to do Ozempic. I started it last Friday, and with the first dose, I have not noticed any difference. My eating over the past 2 weeks has increased a lot. I'm trying to think. I'm trying to make sure I'm correct. Over the past 2 weeks, my eating, I've been really hungry. Like I've been hungrier. No, not even over the past 2 weeks. 2 weeks ago, 3 weeks ago, like my eating habits got bad. So what I was putting into my body wasn't the best for 2 weeks. Now here we are this week. I started Ozempic on Friday. Today is Thursday, today is Wednesday. And what I'm saying is my hunger, like I'm hungrier more often. Like I feel like I'm not being satisfied. And that's more than likely because I haven't been putting the right things into my body. So that's one thing that I have to work on. That's one thing that I'm going to work on. That's one thing that I'm going to work on in addition to the Ozempic. So eating healthier and trying to, I guess, decrease my appetite some. So basically that's all I want to come in and let you know what I'm doing. I'm doing Ozempic. Why I'm doing it. I'm doing it because I need to lose weight. Nothing else is this is the only thing that I can think of to help me right now, in addition to controlling, watching what I eat. Exercise, I would love to exercise. However, I live a very sedentary life right now with my condition. I'm hoping to get better soon so that I can get back in the gym. What I will say is yesterday, although I felt like absolute crap, I did get up and get on the bicycle, and I did that for 20 minutes. Now I was extremely tired afterwards, but I made myself do it, and I'm gonna do the same thing today. So I'm gonna start putting some type of physical activity. It's not gonna be much, but it's gonna be something. Something's better than nothing. So I'm gonna do that. I'm gonna try to watch what I eat. I think right now with watching what I eat, I think what I need to do is focus on calorie counting. So I'm gonna start doing that. And then also I'm doing Ozempic. So hopefully what I'll do is be able to record weekly, let you know my progress. Because I've been eating so much this weekend, I don't expect to see much of any progress. However, a lot of people don't see much progress in the first week because you start off at such a low dosage. To the medication, how it's prescribed, what it is for the first 4 weeks, you start off at a low dose of 0.25. This is the pen. This is what it looks like. Start off at a low dosage of 0.25, and this is the little clicker of how you control how much medication you get. I can't see that. So 0.25, and then you increase, so 0.25 for 4 weeks. After 4 weeks, you increase to 0.5 for at least another month. After that month, you can be increased further. However, right now, my prescription is just for the 0.25 and then the 0.5. And I'll be doing check-ins with my doctor to see where I need to go next. There are side effects. Well, so far this week, there is a side effect that I've had. And I've heard other people talk about it. I've heard other people talk about it. It causes diarrhea. And I thought that I was on top of it. So I took it on Friday. Because my birthday was last week, I went on vacation, and coming back, my system is not regular, but coming back, my system was very regular. So I took it Friday. I didn't think that I needed to do anything for the constipation right away. So I didn't take anything Friday. I didn't take anything Saturday. I want to say I took a stool softener on Monday. However, Tuesday, it hadn't worked. Tuesday night, I took some Smooth Move tea, and I experienced bad pain in my lower abdomen, which typically happens when my system, I know this is TMI, I know my system does not work regularly, but when I'm extremely constipated, backed up, I can feel it. Like, my stomach hurt so bad, it hurt to touch. So my friend is in the medical field. She's a doctor, and she was concerned I needed to go to the hospital for appendicitis, and I'm like, no, that's not what it is. It's because I'm backed up. So she's like, okay, I'll give you today, but if it doesn't get better, you go into the doctor. I'm like, that's all I need. Well, that's all I think I need. So I had taken the stool softener one day. The next day I did the Smooth Move tea. And what happened was I did eventually use the restroom. I did a Smooth Move tea last night as well. It has not worked yet. However, it hasn't been enough time. I'm going to continue combating the constipation with stool softeners and tea. Try to combat that constipation because it is brutal. It is painful. But that's the only side effect that I've had so far. I'll let you know next week whether doing those two options helps or if the constipation comes back, but I'll update you on that. As far as the Ozempic pen, I showed you the dial. Here's the needle, here's the top. The medication, is here. The medication's here. You can see this is where the needle goes. Let me get one out. You do want to keep this medication refrigerated. Well, I was advised that you should keep this medication refrigerated by my pharmacist. I have seen videos on YouTube saying that it doesn't have to be refrigerated, but I'm going to go with what the pharmacy tells me. But here's the needle. Well, can't really see the needle, but the needle is in here. It's like really teeny tiny. You basically take this off, stick it on, screw it on, and then adjust your dose, and you push the button here. You hold it for a few minutes, and then, for a few seconds, and then you release it, and you are done for that week. Now, I'm trying to put the needle back in the pack. This is what the pack of needles looks like. I don't know why they gave me 6 instead of 4. Instead of 4 or 8. Well, I don't know. Maybe they gave me 6 because in case I had an issue with a couple of them. But here's the box that the medication comes in, and then it has a little flap where you are to document the day of the week, because you want to keep it on the same day, the day of the week that you do it. I do mine on Fridays, and then you can actually document the actual date. So that's basically it for this video. Like I said, it is my intention to update weekly to check in weekly let you know how I'm going as far as weight loss. I don't foresee myself having any for this week. However, I will check back and let you know. As always, guys, thank you for watching. Please like and subscribe to my channel. And if you have any questions, comments, suggestions, please leave them in the box below. Bye.